Welcome to the Community Pulse, where we take the pulse of the community so we can take action.
Welcome to the Community Pulse, where we take the pulse of the community so that we can take action. I'm today's host, Liz Agbara, and we're excited to spotlight another one of our local change makers as part of our 20th anniversary celebration. Today, we're joined by Rochelle Davenport. Hello, welcome.
Hello.
Rochelle is part of Zing Health, which is a company that's doing big things when it comes to making healthcare more equitable in our community. So, Rochelle, welcome to the show. We're so excited to have you. Let's get started and have you tell us a little bit about yourself.
Okay, my name is Rochelle Davenport. I am a child of 11. I have 11 brothers and sisters with my mom and dad. I have a bachelor's in healthcare management and a master's in psychology.
Wonderful.
I am an advocate for healthcare.
Wonderful. And that's why, we met, we were trying to remember, the first time we met a couple of years ago at an event, I think at the Pullman Center.
Yes.
And then Rochelle's been kind enough to come through to some of our community engagement and outreach events, such as our Women's Empowerment event, things like that. Thank you so much. It's always really great to have you here.
Thank you.
We appreciate that. Okay, so you said that you have a bachelor's in science, bachelor's of Science in Healthcare Management. Mm-hmm. And so how has that foundation shaped the way that you work today and the work that you do with Zing Health?
So my sister, Barbara Sims, had lupus. Oh. And this was back in 1998 to she passed away in 2000. And so during that time, we were looking for resources and different things that we could do to make her comfortable. Not saying that she would have lived longer, but we were looking for resources. Nobody had resources for us, like homemaker services or hospice services, any of those things, or we were looking. And nobody could give us any resources.
Yeah.
So as when she passed away, people would come up and say, "Oh, you should have did this," or "She could have got this for free," or "She could have got medical equipment." I go, "Wow, I work for one of the biggest hospitals of time, and nobody shared that information from me." I learned this from just people that I met along the way.
Yeah.
And so my goal was like, I never, for my family or for any other family, I never want to see somebody a family going through grief and a family going through sickness and not have not one good resource.
Absolutely.
So that brought me to, I'm like, I have to go back to school, learn some things, and do something different.
Yeah.
And that's what I did.
That's wonderful.
Led to that being the start of my journey into healthcare.
Wonderful. So what does a day in the life of Rochelle Davenport look like?
Oh my God.
Take us through that.
So right now I am taking care of my elderly sister and my niece that had a stroke. So in the mornings we're having breakfast along with me being on meetings, maybe even a meeting, driving to an event, mm-hmm. or going to a networking event in the mornings, or talking to one of my sisters. I have a sister that's a heart transplant survivor for 5 years.
Wow.
Monique Jones is her name. And so I kind of I have become the big sister, I feel like, in the family.
Yeah.
Before Monique's heart attack, she used to be the one to call and check on her. She still does, but yeah. I feel like I had to grow up and become the big sister.
Yeah.
So I'm checking on everybody. I'm driving. I'm in a meeting. So I'm pretty busy all day long. Like if I'm not doing a community event.
Yeah.
I'm checking on somebody in the hospital, or I'm calling someone. So my day is really getting up, running all day to sometimes I'm at events to 9 o'clock at night.
Wow.
You know, but I love what I do.
Yeah.
So it's not like it's a problem. It's okay.
Yeah.
So that's a particular day.
So you're community outreaching in all of our communities, right? In the city of Chicago, in the south suburbs, and then also with your own family.
Yes. And with Zing, I do travel to our other 5 states and do community outreach. We're in Tennessee, Ohio, Illinois, and Michigan. So I do travel to those states to help out with community outreach as well.
Wow. So what are some creative ways that you have found to connect with the community and to bring resources to the community so that other families aren't facing the kinds of things that you and your family struggled with your sister?
So what I do is I build partnerships like our partnerships. I go to the provider meetings and I meet people along the way. They may not be the person to have the resource, but they may know somebody.
Right.
And over the years, I have met and became friends with so many people because I've been in the communities. I go to the Meals on Wheels events. I go to the food pantries, and I go to the churches, and I speak at those places where we're needed to be. And I meet people, and I continue to meet them, and I keep those relationships as if they're my family. They have become my family.
Yeah,
so,
absolutely.
You know, just like you.
Right.
And so I make sure that I cultivate that and that bringing that into my everyday world. For instance, if someone need housing, I know I can call a couple of places and say, hey, I need somebody this is this person's condition. Can you reach out to the family? So I do that on the side for people. Or if somebody need a wheelchair or a lift, I have resources that I built over the years with people that I can give them resources for.
And that's so important, right? None of us can do it all.
Right.
You know, we can't do it alone. So
Right.
partnerships become so important. When you start addressing one social determinant of health, another one pops up, right?
Yes.
You know, we can't get housed if we don't have employment. We can't get employment if we aren't healthy enough.
Right.
If we don't have access to that health care, you know, we can't get the job. So all of those are interconnected.
Yes.
And I appreciate your passion and Zing Health's participation and partnership in that. What are some barriers that people have told you about, and what sorts of things do you and Zing Health help to do to bring those barriers down, break them down, and help get people through to that good quality access to healthcare and healthy living?
So some of the barriers with the people that I meet are food, housing.
Yeah.
Those are the biggest things. Or also finding a great doctor.
Yeah.
So Zing was founded by 3 African American men, 2 whom are doctors from the south side of Chicago. So when they created Zing, they created it based off what they learned from their patients.
Wow.
So we right now have a ESRD plan for kidney conditions.
Okay.
And with that plan, we have 100% transportation.
Wonderful.
You know, sometimes people, that's a problem too. I should have mentioned dialysis. People can't get to and from dialysis.
Absolutely.
Because they don't have enough rides with their different insurances. Well, with Zing, we do 100% transportation. We also offer a grocery card where they can get healthy grocery foods.
Right.
They can use it for over-the-counter products as well. They can use it to pay their light, gas, or water. So those are some of the things that Zing has brought on to the platform of what's the needy population, as we say.
Yeah.
Another thing that I like, we have a program called the PAPA program. That program is based off a total of maybe 60 hours, where they get one person that can go to the grocery store with them, come cut their grass, pull their garbage to the front, just a pal, somebody that can take them to church.
Yeah.
somebody that if they want to go to the casino,
Yeah.
or just be at home playing cards, or a compassionate person.
Right.
That's one of the things. Those are some of the things that Zing is doing, which brought me to Zing, because what I've been doing in the community is exactly what Zing is doing as well.
Yeah.
So, yeah.
Yeah, making those connections, fostering that community feeling.
Yes.
I mean, none of us in any walk of life can do everything by ourselves or be alone all the time. And community connection is so important, especially when you're falling on hard times, whether it be financially or health-wise. So that's so important.
Yes.
Well, gosh, I know that work in this field can be really emotional, but also very rewarding. Can you share a moment that has happened to you that says to you, like, you know what, this is why I keep doing this. This is why I do the work that I do.
Let me go to 2020, January 2020. It's a little emotional for me. My sister received a heart, which was big for our family.
Of course.
Because it was at a point where they told us we had 48 hours.
Wow.
And then she wasn't going to be here anymore. That right there was a whole, I'm sorry.
No.
That was very emotional for myself and my family.
Of course.
Then my mom and her two sisters, they were sick, but we didn't look at them being sick as to they were going to leave us.
Yeah.
So after Monique got her heart, it was everybody think getting a heart. Oh, she got a heart, she's going to be okay.
Right.
She went through a lot.
Yeah, it's a journey.
The journey, and that's why I speak about her a lot. Then in March, we lost a young cousin from heart disease.
Wow.
Then in March still, we lost my mom's younger sister. Oh. Then in June, we lost our mom's middle sister.
Gosh, I'm so sorry.
And then in July, my mom passed away. It was very hard.
Definitely.
And that's why I continue to push to educate. And I work with the Gift of Hope with my sister. I work with the American Heart Association. I work with the Kidney Foundation, and I've been walking with them for 2 years. I do this because it hit home so hard for me. Yeah. Even before then, with my sister from lupus, I had a brother who was a double amputee who passed away from a heart attack, and he was on dialysis. He received a kidney twice, and they both rejected. So when I look at my life, and I think about how other people are going through things through their life,
right?
I want to be that advocate because I know people can say, "Oh, I understand," but you really don't understand until it happened to you.
Yeah,
you don't get it.
Yeah,
and I love the fact that Zing allows me to be me. And they allowed me to bring these things to the community without any, no, you can't. No, Rochelle, you can.
Yeah.
Do whatever you have to do, and we will support you. Last year, Zing sponsored my sister in the Heart Walk.
Oh, wow.
And they said, what you need, Rochelle?
Yeah.
We're not, the company, Zing, not only does things in the community, but they're family. They're my family.
Yeah. That connection is so important.
The connection, because, a lot of jobs don't understand that. And I love the fact that they understand, and they're saying, let's do what we can for the community.
Right.
Let me go back. I remember I was at a senior building when I got the call that my sister was getting a heart. I was literally talking to the seniors about heart disease.
Oh, wow.
And my phone rang, and it was her, and I was like, let me answer, let me see what's going on.
Yeah.
And so for that senior building always remembers that. So they always want me to come back and tell stories about different things. And because they believe in me. They saw it happen
real time.
in real time.
Yeah.
And I went back and gave them an update with that. But my life, and my nieces and my nephew, my daughter, I think about them because a lot of times we only think about the adults in the situation.
Right.
A lot of them have been going through death since they were born. You think about it, with all the people that I have lost in my life. Our children, they had funerals being babies. They had funerals being 1 and being 2. So those things are important to me to look at. Because at first, at one time I didn't look at that. But as I got older, I started looking. We worried about us, but we never thought about our children.
Yeah.
And what they're going through. And they're turning 1, they're at the funeral. They turning 2, they're at the funeral. They turning 3, they got, all of those things matter in life. And so I look at life a little different now than I did before.
Yeah.
And I know that God has put me in this predicament so I can teach and be an advocate for people in need and went through the same things that I went through.
Yeah. And I think that makes you such a great partner in the work that you do in the community.
Yeah.
Really having that firsthand understanding, really walking the talk, right? You're not just talking about it. You're also living it.
Yes.
Through all the work that you do and through all the experiences you've had in life, partnerships in the community are so important. Yes. What are some partnerships that you're proud of or really excited about? Who are some of your favorite community partners?
Some of my favorite is the South Suburban Provider Group, which I'm a part of. For Wellness is a great partnership. I have a good partnership with the Kidney Foundation, the Gift of Hope. Those are some of the good partnerships I have with the American Heart Association. I work with multiple different. I just forgot I'm on the committee for the Alzheimer's Walk in Tinley Park this year. So I am a part of so much stuff that sometimes I have to sit back and look like I'm doing all this. Because sometimes my manager, she'll say, Rochelle, you do a lot. And I'll be like, I don't do that much. And she goes, you do a lot.
Yeah.
You realize it. I'm a volunteer for the Meals on Wheels organization where sometimes we're packing lunches, like sometimes 6 o'clock in the morning or on a Sunday or Saturday, or driving just to make sure that a senior has a meal.
Yeah.
So I do that as well. So
that's so wonderful. Well, and through all those partnerships, I know you've met people at health fairs. You come out to things like this, like our podcast.
Yes.
Why do you think that those sorts of events and a podcast like this is important, and how does it help build healthier communities, do you think?
I think it's important because you get a chance to go out and meet people and tell them there are resources and there are places that you can go. Because sometimes people are afraid, but if they feel like they're comfortable with you and they can trust is a big thing.
Definitely.
Especially with our seniors. If they trust you, they will confide in you to help them. So I think that being a part of that and going into different organizations and working with those organizations, we just had a big meeting with the Gift of Hope and the American Heart Association and the Kidney Foundation, and we was talking about how we can brand together to bring these resources and things to seniors and people, period.
Right.
I'm actually doing a segment this summer where we're partnering with Roseland's mammogram bus. So we have did 2 so far in the park and at Oak Street Health, where we're allowing our members to come and do a mammogram.
Yeah, wonderful.
So we're doing pretty much a lot of those things.
That's so important. That's so important, and that's keeping communities healthier.
Communities
bringing
healthier.
the resource right to the community.
Yes.
So, what advice do you have for someone that says, "Oh my gosh, I'm inspired by the work that you do," and I love your story, Rochelle. And so, someone who wants to get involved in community health and community health care, what advice do you have for them? How do they get involved? Where's a good place to start? How do we look?
So, my first thing is, and I'm going to tell you what really, I started going to the provider, Southland provider meetings.
Okay.
And I started meeting people that have resources. And
Yeah.
the good place to start is honestly with me, because I think I'm a great teacher, and I have people have asked me to mentor them into these the younger generation, and I do, and I give them steps. The first step I would say is networking.
Yes.
Networking is the key to everything. You get a chance to meet a lot of people. I know my journey, 2016, Governor States and all the mayors of the South Suburbs gave me an award for all of the work I had did in the community when I was working for Zing Health at the time. They looked at that kind of helped me too, because I had a lot of people like, I saw you, I saw your picture or something like that. But I also like the fact that, I have resources. I have worked with Oak Street Health, and we do, they're one of our Zing's biggest partners right now. So we're able to get people into the clinics, and, so I can always give those resources. Like, hey, I know so-and-so over at Oak Street.
Yeah.
That may be a start for you if you want to go in the clinic. We can do a lunch, or we can do give you information who to reach out to when it comes to networking.
And that personal connection is so important, right? It has to be, that helps break down barriers too, right? Where we're a little bit afraid to just walk into a place and say, I want to get started, so having that personal connection. So thank you. I'm so glad that you're up for yet another task and mentoring our youth and, getting people involved. That's so wonderful.
Thank you. Thank you.
I do know that this work, nonprofit work, healthcare work, connection to community can be so difficult.
Yes.
Do you have any personal mantra or something that you say to yourself or tell yourself when times get tough and you have trouble feeling like motivated to move on? What are some things that you tell yourself? What are some tips and tricks for Miss Davenport?
So for me, I even did this when my sister was in the hospital when she was having a hard time. I told her, and I found a plaque that said, tough times don't last long, but tough people do. And we are tough people.
I love that.
And prayer. I can't do anything without God. All the things that I do, I just can't do it without Him.
Yeah.
And so that's what I do.
That's wonderful.
Yes.
Well, Proactive Community Services here, we are celebrating 20 years. We turned 20 on February 1st, so we're taking all of 2025 to celebrate our 20-year anniversary. And Zing Health is out here making moves. Why is the collaboration between an organization like Zing Health and Proactive so critical, especially right now in our political climate and the healthcare climate? Why are these two organizations, you think, so important for us to work together?
Because we need to spread the word. There are so many things and products and things that Zing is doing right now, especially with the kidney conditions and transportation and those kind of things with our seniors.
Okay.
And I think that the partnership with us, because you guys have the same vision as we do, and I think that us working together in the community is a great thing, because we're able to spread the word not only about Proactive, but to spread the word about Zing and work together in the community, because we are in the community together.
Definitely. And
we can come up with different things that we, as partners, can make happen for our needy people that's out here right now. Yeah. I'm sorry, I got a little emotional and choked up with my voice.
Oh, no, of course. Yeah. It's understandable. I think that my favorite thing to do is talk to other community partners. And I think I've been in this work for about 20 years, and I have yet to find a single person that's involved in this work and does this work that doesn't have an emotional story, right? All of us have some point in our life, have either been in need or had something happen or have this like connection somehow to community that leads us to serve, right? That's servant leadership. So I appreciate you sharing with our whole community here your story and being vulnerable, you know, and taking that space, because that's how we make meaningful connections is by being vulnerable. So our upcoming 20th anniversary gala is about raising funds and raising the equity in our healthcare system in our community. And so, what would you say to someone who's thinking about making a contribution or is thinking about supporting our work? What do you say to them? Do you think this is important? You know, why is this important? What would you tell them?
I would tell them that this is important, because we need to make sure that we're coming together as a community to talk about and discuss healthcare. So my suggestion would be we have to do this. We have to do a sponsorship. We have to connect together in order to make it one sound, one band.
That's right. That's right. And it takes all of us to do it, right?
It takes a village.
It definitely does.
Yes.
So looking ahead, looking at the Southland, looking at the challenges ahead, but also how far we've come, what gives you hope? What gives you hope for the future of our healthcare system, the future of healthcare in the south suburbs and in the city of Chicago?
My family. They give me hope because they support me. I support them. And I see results when I help them. And I just think that family is important. And I'm not just talking my immediate family. I'm talking about my partners, such as you guys, for wellness and Senior Talk with Claire Hubbard and, you know, the Southland Chamber of Commerce and all of those, Continental Care, all of those people together. We'll all have, like I said, one band, one sound.
Right.
So all of those people together to make sure that things are happening in the community to help our youth as well as our seniors. So
and everyone in between.
Everybody in between.
That's right.
Yeah.
Well, Rochelle, I feel like I could talk to you all day. But I want to say, like, as we start wrapping up our conversation here and taking it offline, how can our listeners learn a little bit more about Zing Health and get connected to you and your outreach team?
So you can reach out to me. I'm Rochelle Davenport, and I don't mind sharing my telephone number. My number is 708-204-0565. You can also email me at Rochelle, ROCHELLE .Davenport, DAVENPORT at myzinghealth.com.
Wonderful. Rochelle, thank you again so much for coming. Your story is powerful. It's impactful. It motivates me every time we talk. I have a great time. I'm inspired to keep going. So thank you so very much for everything you do in the community. Everything. And to our listeners, don't forget to follow the Community Pulse wherever you listen to your podcast. Stay tuned because we are celebrating 20 years of service at Proactive Community Services here. Until next time, stay engaged and stay proactive.